Welcome to this YouTube channel. In this video we are going to talk about food shortages and COVID-19. Before starting this video, like this video and subscribe to our channel for future updates. Many nations are grappling with rising food insecurity, which is undoing years of progress and jeopardizing the achievement of the Sustainable Development Goals by 2030. Chronic and acute hunger were on the rise even before COVID-19 decreased earnings and disrupted supply chains. Owing to a variety of variables such as conflict, socioeconomic conditions, natural disasters, climate change, and pests, COVID-19 has resulted in significant and widespread increases in global food insecurity, affecting vulnerable households in almost every country, and the effects are likely to last until 2022. The World Bank's approach to increased food insecurity during the COVID-19 epidemic is examined in this brief overview. While the global food supply picture remains positive, food prices are near all-time highs, and high transportation costs are driving up import expenses. This has the greatest impact on impoverished and developing countries, as they rely on food imports the most. The Agricultural Commodity Price Index is 25% higher in January 2022 than it was in January 2021. Maize and wheat prices are 20% and 25% higher, respectively, than they were in January 2021, while rice prices are around 21% lower. The picture for food and nutrition security in many low and middle-income nations is bleak, with economic recovery faltering, COVID-19 uncertainties and disruptions persisting, and fiscal capacity deteriorating. Labor shortages, a dramatic increase in the price of fertilizer, currency devaluations, and other reasons are all contributing to severe food price inflation at the retail level in a number of countries. People in low and middle-income nations are more affected by rising food prices because they spend a bigger portion of their income on food than people in high-income countries. The World Bank conducted rapid phone polls in 72 countries and found that a large percentage of individuals are running out of food or limiting their consumption. Reduced calorie intake and poor nutrition jeopardize advances in poverty reduction and health, and may have long-term consequences for young children's cognitive development. According to the UN report on the state of food security and nutrition in the world, between 720 and 811 million people would go hungry in 2020. Around 118 million more individuals faced chronic hunger in 2020 than in 2019, based on the center of the anticipated range, 768 million. According to a separate statistic that tracks year-round access to adequate food, approximately 2.37 billion people, or 30% of the global population, lacked appropriate food in 2020, up 320 million from the previous year. Recent research also suggests that the number of people facing acute food insecurity will rise significantly in 2020 to 2021. Acute food insecurity is described as a situation in which a person's life or livelihood is jeopardized due to a shortage of food. According to the Global Network Against Food Crises, 161 million people in 2021 suffered crisis levels of severe food insecurity, up nearly 4% from the previous year. In addition, 227 million people were expected to be suffering from stressed acute food insecurity in 2021, over 7% more than the previous year. Even before the COVID-19 pandemic, hunger was on the rise, exacerbated by the effects of catastrophic climate events, conflict, and other shocks to economic possibilities. In 2021, 81%, or 132 million, of the 161 million individuals experiencing crisis lived in nations afflicted by fragility, conflict, and violence. Support from the World Bank. The World Bank Group has committed more than $157 billion to combat the COVID-19 pandemic's health, economic, and social effects, making it the fastest and largest crisis response in history. More than 100 nations are benefiting from the funding, which is being used to improve pandemic preparedness, protect the poor and jobs, and kickstart a climate-friendly recovery, notably in agriculture. At the country level, the World Bank Group is collaborating with governments and international partners to closely monitor domestic food and agricultural supply chains, track how job losses and income affect people's ability to buy food, and ensure that food systems continue to operate despite COVID-19 challenges. The bank's early response in the poorest countries was detailed in responding to the emerging food security crisis. A study released in December 2020. Between April and September 2020, IDA delivered $5.3 billion in new pledges for food security. This has been accomplished through a combination of COVID-19 interventions that are short-term in nature and investments that address the longer-term causes of food insecurity. The following projects are examples of short and long-term financing. In Bangladesh, a livestock dairy development initiative launched an emergency action plan that offered $87.8 million in cash transfers to 407,000 vulnerable dairy and poultry farmers to support their enterprises. Personal protection equipment, farm equipment, and improved veterinary services were also covered by the funding, which included the purchase of 64 mobile veterinary clinics. The World Bank's portfolio in Bhutan has been realigned to assist food distribution in the short term and increase food production in the medium term through input supply and irrigation. In Chad, $30 million in emergency funding was mobilized to provide food assistance to 437,000 vulnerable people experiencing severe food and nutritional insecurity in both urban and rural areas, as well as to provide seeds and small agricultural equipment to 25,000 poor and vulnerable smallholder farmers in order to preserve their productive capacity for the upcoming growing season. The Responding to COVID-19, Modern and Resilient Agri-Food Value Chains project in Guatemala aims to improve the efficiency of key agricultural value chains and invest in modern technologies and practices in order to provide emergency response to COVID-19 and increase economic and climate resilience. The Resilient Productive Landscape project in Haiti raised emergency funds to assist over 16,000 farmers in obtaining seeds and fertilizer, ensuring production for the next 2 cropping seasons. In India, women's self-help groups mobilized under the World Bank-funded National Rural Livelihoods Mission to meet mask and sanitizer shortages, run community kitchens and restore fresh food supplies, provide food and support to vulnerable and high-risk families, provide financial services in rural areas, and disseminate COVID-19 advisories. These self-help groups, which have been in existence for 15 years, draw on the expertise of over 62 million Indian women. The World Bank supported, GAFSP-funded Agricultural Productivity and Nutrition Improvement Project in the Kyrgyz Republic, which focuses primarily on improving water infrastructure and developing the capacity of water users associations, WUAs, distributed $1.1 million in agricultural inputs such as seeds and fertilizer to vulnerable populations through 30 project WUAs. The Sustainable Agricultural Intensification and Food Security Project in Rwanda has received more funding to help it deal with the effects of COVID-19 lockdowns. COVID-19 compliance was also added to the bank's existing social protection initiative. In Senegal, a $150 million IDA credit is helping to boost exports of high-value crops like shelled groundnuts and horticultural products, boost dairy farming productivity, and lower small ruminant mortality, all while mitigating the pandemic's negative effects and investing in more productive and resilient practices. In Sierra Leone, emergency funding from the Smallholder Commercialization and Agribusiness Development Project is supporting government COVID-19 response measures by providing inputs, land mechanization services, and extension services to rice farmers. The Social Safety Net Project, which is funded by the World Bank, has also expanded its cash transfer system to help the most vulnerable households. The bank sponsored cash transfers to food-insecure households with children under the age of 3 in Tajikistan through an existing targeted social assistance scheme to reduce the effects of rising food costs and protect children's nutrition. Prevention. We're dedicated to assisting countries in preventing the next zoonotic disease from becoming a pandemic and better preparing for when dangers arise. The experience of the World Bank with avian influenza demonstrates that cross-sectoral, coordinated investments in human, environmental, and animal health, the One Health strategy, are a cost-effective way to manage risks and control infections at the source. Animals are the source of more than 70% of emerging infectious diseases, EID, in humans. In a fast-changing environment, pathogen transmission from animals to humans and EIDs is growing, with deforestation, land use change, and rapid population expansion enhancing human exposure to animal-borne diseases. Countries can invest in longer-term preventive measures, such as increased veterinary services, disease surveillance, and food safety, under the first COVID-19 package of World Bank Group finance, the COVID-19 Emergency Response and Health Systems Preparedness Project, for example, in India will strengthen disease surveillance systems in humans and animals, as well as health information systems. A new effort in China aims to improve risk-based surveillance systems for zoonotic and other emerging diseases. It will improve risk assessment, diagnostic, and monitoring capabilities for human, animal, and wildlife illnesses. It will also strengthen information sharing processes amongst relevant agencies. What do you think about this video? Do let us know down in the comments section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.